Ms Patten.
Thank you, Acting President. And there is a slight feeling of Groundhog Day because I think when we started this motion earlier this year, I spoke after Ms Terpstra did, and I'd just like to first start by congratulating Ms Terpstra and Mr Finn on successfully quitting tobacco. And successfully quitting smoking successfully. And as both of you attest, it is not easy. It is incredibly difficult. And this is why this motion is important. This is why, if we can look at providing every tool to stop someone dying from lung cancer, and as Ms Terpstra mentioned, she has a very personal connection with that, and many of us would have a friend or a family who has died from smoking-related diseases. In fact, it is, as this motion puts, it is one of the biggest killers. It kills hundreds of thousands of people in Australia every year. So we should be doing everything that we can to stop that, to reduce that. And we know that we're not. We're not, because we are refusing to accept the science around vaping. We are refusing to accept the science around tobacco harm reduction. And, you know, people say, oh, we're not entirely sure, there's not been enough evidence. I've just been reading, and I was actually very privileged to write the foreword for the Global State of Tobacco Harm Reduction 2020. And in this report, it shows that actually there's been about 6,000 studies done on vaping. We know the science. We know that, yes, it's not entirely safe, but neither is aspirin, neither is vitamin D tablets. There are many things in this world. In fact, there is probably nothing in this world that is 100% absolute safe. But what we do know is that they are far safer than smoking. We do know that these do not affect your lungs in the same way as smoking does. We do know that smokers who use vaping as a form of quitting or reducing reducing the number of cigarettes that they have are very successful, far more successful than patches, far more successful than chewing gum. I would possibly even say more successful than hypnotherapy. Vaping has proven to be extremely successful in assisting people to reduce the harms of tobacco smoking. And there is no doubt. And I know, you know, the previous speaker, Ms Terpstra, has a good interest in Japan. Now, Japan has cut their rates of smoking by 32% since the introduction of heat-not-burn tobacco and vaping. 32%. Guess how much Australia, or guess how much Victoria has reduced their smoking rates in the same time? 1%. We actually had a goal that I think we'd be down to 5% smoking rates by the year 2010. All right, didn't hit that. Failed. All right, let's set it for 2020. Failed again. In fact, our smoking rates have remained stagnant in Australia and in Victoria for years now. And what we actually saw during COVID was an actual, probably for the first time in 50 years, an increase in smoking in Victoria. Now, those stats will come out in just a few weeks, but we will show that there has actually been an increase in smoking rates in Victoria since COVID and during COVID. Now, that is incredibly alarming, and we know that it actually affects our low-income and most disadvantaged people. You've picked the 5 most disadvantaged postcodes in Victoria, and that's where you will find the highest level of smoking. So this motion is very important with that. And I know Ms Terpstra talked about the Australian Institute of Health and Welfare being the National Drug Strategy, the household survey, but because we do not assist people to access this very, very good, safer treatment for reducing or quitting smoking. We do not enable people to do that. In New Zealand, they are looking towards zero smoking. They are looking to be a smoke-free country by 2030, and they are on track. And do you know what they're using? They're using vapes. They're using e-cigarettes. They're using these nicotine devices where you don't smoke, and they are finding incredible success. They did this really interesting study with some Maori women, and these were Maori women in a very disadvantaged part of the North Island of New Zealand, and these women were struggling to pay for their tobacco and food on the table. And they were, quite often, they were skipping meals to ensure that their children had food and that they could maintain their addiction. So in that case, the New Zealand Health Department ran a pilot where they offered them vapes. And 50% of them stopped smoking. 50%. Like that, you do not see those types of quit rates anywhere, ever. With cold turkey or Just Say No or patches or Nicorettes. This was a phenomenal result. And that result 1 year later is still at that rate. They had an incredible result there. So why we are not allowing this, why we look at harm reduction in every other way. You know, Australia was one of those early adopters for needle and syringe exchanges because we knew that if we could provide clean equipment to people who were using drugs intravenously, that could prevent diseases like HIV and hepatitis C from being transmitted. And we were right and we were successful. So why are we not taking this same approach of harm reduction when it comes to tobacco? I just don't know. And people say, oh, it's big tobacco. Well, I tell you, by prohibiting these types of products, you are falling straight into the hands of big tobacco. Big tobacco loves the prohibition on e-cigarettes, absolutely loves it. This is the best thing for them. Now, I wonder, and this is very speculative, and I have questioned the Cancer Council. The Cancer Council, one of their biggest donors is Woolworths. Guess what? Woolworths is the biggest retailer of tobacco in Australia. Now, I know I'm probably putting 2 and 2 together and getting 5, but the Cancer Council opposes this harm reduction product. Opposes it, said you shouldn't use it, there's not enough research, it might be dangerous. You know, they will concede that it is safer than smoking, but they will not accept that it should be part of a harm reduction policy, a harm reduction platform, a smoking cessation platform. They do not accept that, and that is the problem. But they accept money from one of the biggest tobacco retailers in Australia. I know there's other smokers who want to speak, so I'm going to. But I'm not a smoker. I was a smoker. I'm a vapor though, and I don't vape often because I didn't smoke often. I was a social smoker, and I'm a social vapor, but I have not touched tobacco for, well, we're getting on for nearly 2 years. And I'm around smokers a lot, and I have, from a personal perspective, I have found that it worked for me from the number of people who have written to me about how it has saved their life. I cannot for the life of me understand why the Victorian government, who has been a leader in harm reduction, a leader in harm minimisation, would not fully support nicotine vaping as a safer alternative for smokers. I fully support this motion.